Welcome to SeriousTech, Engineering the Future, a podcast where we deep dive into the critical role of domain expertise in shaping successful careers in technology. In a rapidly evolving tech landscape, mastering a specific domain is what sets top engineers apart. Join us as we explore how domain tech is transforming industries with a special focus on healthcare, and hear from experts who have built cutting-edge solutions by combining technical brilliance with specialized knowledge. If you're looking to stay ahead in your tech career, this is the place to be. Joining us today is Siddharth Sheth, Senior Vice President and Head of Engineering and Quality Practices at CitiusTech. With over 14 years of leadership at the company, Siddharth has been pivotal in driving innovation and advancing cutting-edge healthcare technology solutions. From his beginnings as a principal architect to his current role as Senior Vice President, Siddharth's journey showcases his deep expertise in software engineering and healthcare IT. His leadership is defined by a forward-thinking approach, leveraging advanced technologies like cloud computing, AI, and data analytics to enhance patient care and operational efficiency in the healthcare sector. Siddharth has played a key role in shaping CitiusTech's vision to deliver impactful, tech-driven solutions. In today's discussion, as part of our SeriousTech series, we'll explore Siddharth's perspective on the future of healthcare technology, including how emerging innovations are set to transform the industry and improve outcomes for patients and providers alike. Siddharth, welcome to the podcast. We're so thrilled to have you with us today.
Thank you, Laurel.
Such a pleasure to have you. You've dedicated nearly 14 years to CitiusTech. Reflecting on your journey, how has your perspective on healthcare IT and that sector evolved, and what has kept you motivated through these years?
Laurel, I think the first few years, I will be candid, right? It was a very different years for me, right? So I joined from a non-IT or non-healthcare sector. My early 3-4 years, I was very focused on building IT solutions, focusing on technology, focusing on how the technical piece of work going out. Over time, I realized that whatever I am doing, it's not only IT, it's beyond IT, right? Whatever I am doing or whatever my team is doing, it influences direct patient care and outcome of the patient was another part of it. Also, the industry has evolved, right, over a period of time. So I joined 14 years back. Healthcare from IT perspective was very different, right? It was not that patient-centric, and technology has evolved over a period of time. There has been evolution of cloud, AI, data analytics, various different transformation has happened over a period of time. The knowledge that our work is making the real difference. I mean, when I say real difference, is real difference not to the customers, right? Not to the not to our stakeholders of the company. It's making real difference to the society, which is finally the patient and human. That keeps me motivated. I mean, candidly, and then working with the talented folks in my team, right? When we have equal amount of passion against this particular thing. So that keeps me motivated. That keeps me engaged. That keeps me keep on going in CitiusTech.
What an excellent answer. It's not just the job that you're doing in that technical aspect, it's the impact that it has, and it's directly impacting lives. And that motivation and drive to keep giving back and continue, especially as you said, in such a rapidly evolving sector and field. And in those 14 years and this time in healthcare IT sector, I'm sure there's been a lot of projects and moments that have kept that motivation going. Can you describe a pivotal moment or a project where a breakthrough engineering solution from your team really improved that healthcare delivery? And also maybe what were some of the challenges and what impact did that have?
Laurel, candidly, there are many. I mean, if you are asking me one, I'll let me. But I think there are plenty. I mean, there are every occasion we are seeing that. But one thing which comes very quickly on my mind is we were working on a very key project. The customer reached out to us, and they said that they want to develop a 3D printing solution. And the solution was allowing surgeons, especially the surgeons who are doing ortho related operations, right? To use this particular printing tool, right? And the initial challenges were many, right? So we had to do 3D printing. There was, by the way, when you do 3D printing project, our operation was only to do engineering, right? So development work. So the printer was developed by someone else. We didn't see the printer, right? We were doing a solution development or software development, which was primarily the medical images, and you see the 3D images, and you have to go and show those images and make sure that the 3D replica is showing out in the viewer very clearly, and then use the precise algorithm which is prescribed by the printer so that the print command is shared successfully right to the printer. And then there are a lot of other complexities involved because our engineers may not have the right amount of experience on 3D image processing, and how do we do image processing or 3D into a web-based viewer. We did that. I think it took around a year and a half for us, probably a year to develop that. And we developed the solution. I mean, it was shipped. Now, whenever we do engineering, right, we don't know whether that engineering gets used or not, right? So we generally ship it, and then customers will sometimes ship it to the end user. And one day, we were going through a magazine. It was a very well-renowned healthcare magazine, which had an article of a football player was actually having a ankle surgery. And the articles mentioned about the same tool which our engineers developed. And that was so exciting and so touching for us, right? That the innovation which we did was actually helped that. And the article said that the innovation which we created, which was helping the patient, or which helped the patient in faster surgeries, better outcome. And then it reduces the complications, which generally happens in such kind of a surgeries, because you are changing an elbow, you are putting a ball inside the elbow, right? So you may end up having some complications. Now just think about it, right? We were developing this for a year. Our developer did not even know what they are developing, right? They were thinking that, okay, there is something which is going to get out. Right after a year, after 6 more months, we saw an article which actually says that a football player got benefited from this. And there are plenty of such examples after this, because I'm talking about the incident which happened around 5-6 years back, when the 3D printing was not that usual. Now we are hearing a lot of stories around 3D printing, but this was a big adoption of use case, which I think didn't only directly impact the patient, but hearing the feedback of surgeon, right? Because surgeon was saying that because of this, it changed their life. Whatever the surgery could have probably taken 2-3 hours, now has taken only 40 minutes or 60 minutes or 50 minutes, right? So it saved that surgeon's time enormously. Now the productivity of surgeon has improved. Now a surgeon can do double time, right? There are plenty of other examples as well, but I think this one really touched me because that article came out, right? And it was so well written and so well explained. Definitely there are many examples, but I would like to just bring in, since we are talking about this topic, I would like to bring in the COVID vaccine. While everyone says, and there were a lot of people who rang the bell, and a lot of things happened for for scientists and doctors, right? Where scientists and doctors could able to find a vaccine for within 1.5 years or whatever, right? Mm-hmm. The reason behind that is a lot of engineering work, or a lot of engineering effort has gone, writing the code, doing analytics, doing a lot of work behind the scene, which engineers are doing. They were not appreciated. So I like to definitely say that while doctors and scientists definitely save the life, at least CitiusTech engineers saves the lives for sure.
Yes. Hearing these examples, which were excellent examples, and how a lot of heart and care and expertise are going into these developments, and being able to see them in use, and it not only just improving the lives of patients and practitioners, but in the case of the vaccine, saving lives. I mean, what an amazing impact is having, seeing your work out in the world like that. And that's very rewarding, I'm sure, and very motivating. And it's something that you touched on in your first example, that the 3D printing and how that was new technology and it's becoming more and more used. As you're looking ahead now, what is your vision for this transformative potential of technology in healthcare, and how are you foreseeing more emerging technologies reshaping patient care and also operational efficiencies over the next, I could say next decade, but over the next 5-10 years?
Well, I think great question. A lot of people ask this question. in general, there are many articles. I think if you see the way the industries have evolved, right? The finance industry, or if you think about logistic, they've gone through a lot of digital innovation. Healthcare has not been yet. Because of the complexity of domain, because of the complexity of implementation, as well as the sensitivity about the healthcare data, especially, right? PHI data. Next few years, I feel that is going to be the healthcare dominated years. Lot of things, I feel, for example, AI, the diagnostics currently, which happens with doctors diagnosis cancer, for example, or heart disease. With AI powered diagnosis, what it will happen is it will help doctors to predict certain things, right? That, okay, for example, so patient may end up having cancer after whatever reason, or it may detect the cancer much early, or it may detect the cardiac issues much early than actually it happens, based on whatsoever, right? That's one. There are a lot of people studying about genetics and genetic data, which is not only the unknown at this point of time, but applying analytics on top of genetics data will actually help us personalize certain medicines in future. So if I have a particular type of blood group and someone else has a particular type of blood group, and we are referring currently everyone with a similar type of diabetic medicine, in future that may probably change, right? That will probably help moving the needle. These are the very high-end examples which everyone talks about, like AI and personalized medicines and genetics data and all. But in next few years, at least what I see, at least from CitiusTech angle point of view, right, we are seeing a lot of interoperabilities is in question. At this point of time, most of the healthcare applications can't talk to each other very easily. There are healthcare applications providers, EHR companies, they're reaching out to us and they're asking us, how can we do interoperability? And since we come with a lot of background of healthcare, and we have worked with a lot of customers who have been looking forward for that. I think interoperability is going to be the big focus area for us. There are a lot of other things which, for example, operational efficiency using AI and automation. How do we make with automation, with GenAI, or with AI itself? How can we automate certain administrative processes, which currently takes a lot of amount of time for healthcare to manage operations? Let's say, for example, prior authorization. We have been talking about prior authorization takes a lot of time because of whatsoever complexity of workflow. GenAI can make this prior authorization very easy. We have a couple of use cases where our GenAI team is working on prior authorization, right? So that also is another interesting example, right? So third thing is remote care, remote monitoring, IoT and remote monitoring, very important example. So there are plenty of such use cases. I think AI-powered diagnostics, interoperability, remote care, remote monitoring, operational efficiency using GenAI are few of the examples. And healthcare has a lot of ground to cover over next few years, Lauren.
It does, and it's rapidly expanding, and these are certainly areas that are exciting, looking forward to, and as they grow. And CitiusTech really has so much experience in healthcare IT, and that's what they know, that's what they bring to the table. And so what unique aspects of CitiusTech's approach to that healthcare IT make it an appealing destination for engineers who are really passionate about addressing some of these pressing issues in healthcare today and want to touch lives and give back like that?
So I think, at least since I joined Laurel, right, what I've seen is the first lesson I learned from my boss, who's Jagdish Murjani, and a couple of others who I have been working with, right, is whatever we do is going to impact humans' life. So let's be really mission-driven work. I think that's first thing, which is a very important thing, right? We as a company, we have always thought that whatever I do is directly going to impact someone's life. So let's take that as a priority. Second thing is we are very focused on innovation. I think most of the work which citizens do, we think about culture of continuous innovation. We think about encouraging our engineers to push beyond their boundaries. We call it 110% initiative in CitiusTech lingo. We give 100% to customer, but give 10% extra to the customer. I think that's what we call it as innovation. That's our lingo, but that's what we generally drive for. And there's a process towards it, right, to innovate. Third thing is we collaborate with healthcare experts, right? So we have a lot of partners which we generally collaborate with. We work with them. We work along with cloud partners. We work along with healthcare partners. We work along with certain experts in the particular area, just to make sure that we don't only go and sell technology to our customers, or we don't only deliver technology to our customer, but what we deliver or what we sell is beyond technology, right? A solution, which is a healthcare solution. So I think that's what makes difference in CTS Tech. That's what at least I have learned in last 14 years while working in CTS Tech.
Yes. Mission driven, 110%, knowing that what you're doing is going to be touching people's lives across the world. Really, everyone needs healthcare, and as you know, as these unique aspects are a part of CitiusTech, why do you believe that CitiusTech holds the biggest opportunities to solve healthcare's toughest challenges as everything is continuing to constantly advance and evolve?
So I think first and foremost, I'll tell you, I'll once again stress on one point, right? We are 100% healthcare focused company, Laurel, right? So we don't work on any other domain. In fact, if we get an opportunity, we try to say, okay, we are healthcare company, right? And that's what we're proud to say, right? So when we go to customer, we don't say that, okay, we will do a great cloud work for you, or we will do a great data work for you. When we go to our customer, we'll say, okay, we will build a great medical imaging viewer for you, or we will integrate a great medical solution for you, or we'll do a great work in building this data, which is a healthcare data, because we know fire very well, or we know HL7 very well, right? So a domain expertise, which not only our consulting team carries, but each and every engineers carry in the team, right? And that's the reason why what we do is we have an internal initiative called as health tech track, or health tech specialization track. We call by the way, all our initiatives are health tech initiative in CTS Tech, right? We call health and tech together, because we don't only sell technology, but we do health as well, right? And what we actually do is we train our engineers on healthcare, right? So while it's very difficult, because engineers generally don't come with healthcare background, so we hire from anyone in the market, right? So we'll hire people from the same companies who have not been working on healthcare. Someone may have joined in finance, right? So from finance domain, right? Now for 7-8 years, that person may have worked in finance domain. The first thing we do is, anyone who joins CTS Tech, first 7 days, please go through a healthcare training. It's a mandatory, right? Post that, if they are going to a project which is a very, very specialized in DICOM or medical imaging, we make sure that that person joins that next level training. So we call L1 training, which is the first 7 days. And after that, we do the L2 training, which is really focused on what project he or she is going to work on, right? That's what I think is a biggest advantage which CTS Tech has over all other competitors of CTS Tech, right? Because since we live life with and I keep on giving this example to a lot of people, right? It's like you're going to a specialized Italian restaurant versus a multi-cuisine restaurant, and the feel you get from specialized restaurant is very unique, right? You get a very special treatment, you will get very authentic recipes, you will get very authentic taste. Multi-cuisines will serve you the same food, but that extra 1% of taste which is missing, you won't get that. You'll get only in the specialized restaurant, right? That's what I think we are, right? That's what is the biggest opportunity to solve, gives all our customers also. And we believe that because of that, we can solve all complex problem of customer, to answer your question, right? I think that's one thing. I've spoken about innovation-driven culture, 110%, partnership, lot of other things, right? We are very agile organization. We have commitment for innovation. We keep on telling our customers that we will achieve that extra 10% for you. But I think if I just dilute everything what I said, after all, the first 2 minutes is healthcare is bringing our organization together, and I mean, we are very committed. In fact, one problem which we keep on saying, that as we grow, how can we make sure that our quality of training of healthcare remains the same? And that's what the kind of problem which we are trying to solve. And we have identified this health tech specialization track, which I think is a really unique way of making sure that everyone in CTS Tech learn the same domain language, which we are really expert in.
I think that was a great analogy about the restaurant, for one thing. But yeah, the healthcare, it does sound like a very unique aspect to the knowledge, the expertise that the engineers have. It's not just knowing the tech piece of things and the solution, the problem solving, but I guess maybe the greater why you're doing it, it's for health. And I think that's a very unique aspect and very important aspect as well that's brought.
Absolutely.
Yeah.
Yep.
And Siddharth, as we we close our discussion today and you're looking back on your career, your work at CitiusTech, what is one piece of advice that you would give to these aspiring engineers who want to make a meaningful impact in healthcare tech?
One piece of advice would not be. I'll give many pieces of advice, but that's what it is. Because one piece, I'll say one piece at the end, right? Probably,
Sure.
maybe I'll save that for last. But I'll give 4 or 5 advice, and then I'll go for one piece of advice. But the first advice, I think, I'll tell everyone to stay curious. I think curiosity is very important when you work in this sector. Willingness to learn, first of all. I've seen engineers join, and then they're and recent word, especially when everything is so remote operated, people work from home, and then they join and they feel healthcare, CitiusTech, yet another company. Please don't do that. If you are joining CitiusTech, you come with a mission that you are going to save someone's life, right? So keep that in mind. Stay curious. Second is understand the big picture. I think I was on a call with one of my team today, and I asked them whether you know what your customer is doing. What is the big picture? What is that they're trying to solve? Give that a chance, right? I'll tell this to everyone in CitiusTech. And if you're a citizen who is listening, please be curious, understand what your customer's business is, understand what customer is trying to solve, whether it's a payer or a provider or a medtech customer. Just be aware of that. Third thing is, which is very important, is be resilient. I think the path for innovation is not always easy. You have to be resilient. And we have a patience for that making a difference, right? I think the last thing I would say is, before I go to your one point, Laurel, I still remember, is focus on impact, right? I think always remember that the impact what you are making is not that impact which is which is going to be to your customer only, right? Just it's impact to the society, right? It's not even to the patient, it's impact to the society which we are going to carry, right? So just make sure that while you're being curious, you are trying to understand the big picture, you're collaborative, you're communicating well within your team, all other things, but just focus on the impact which you're going to make in the society and be focused on that, right? I think that's what I'll say. Coming to your point on one point, right? I think as an engineer, I think much like physicians generally guide by the Hippocratic Oath, right? I think you must have heard about that. As an engineer, we also have a duty to create a solution which can heal, improve, and save lives. That's our duty as well. It's not only doctor or scientist duty. We also should take, at least CitiusTech employees should take that oath. Whenever we do and whenever we write every line of code, just think about it, that whether my line of code is going to save someone's life or not, right? I'll use that last statement because I keep this code to care as a very close to my heart, and I would like to dedicate this episode to that one line, right? That let's make sure that whatever code you write, please make sure that it's for a care for someone. I think that's what I'll end with.
As you were giving that wonderful answer, I was really visualizing this thread through all your different pieces of advice of staying curious and always wanting to continue learning and growing in that aspect, and looking for solutions and the projects that you're creating and working on, as well as the impact that they're going to have. And you say, code to care, and that the impact of engineers saving lives in this space. So I think that's perfect. And thank you so much, so much for your expertise and this conversation today. It was really wonderful. Thank you so much for your time, Siddharth.
Thank you, Laurel. Thanks for your time as well.
The SeriousTech Engineering the Future podcast is brought to you by CitiusTech, a leader in healthcare consulting and IT services. To find out more about CitiusTech, visit CitiusTech.com. To listen to more interesting insights on healthcare technology and innovations, search and subscribe to CitiusTech's YouTube channel.